Okay, well, that is our cue. Let's go ahead and get started. Welcome to today's project scope session. Again, if you will just drop your name and contact information into the chat, that just helps us to know who's on the call. And if you have somebody that you want to reach out to, you can always do that. We are recording today's session. By participating in this session, you are being consented to be recorded. But if at any time you need to leave, you can just go ahead and disconnect from us. Our recordings do go on our Canvas page, and we use those for education and quality improvement. Here's how to rename your profile. As you may have heard, each of our hub members will have an asterisk in front of their name. So if you have any questions or need to figure out how to do something, please go ahead and reach out to one of them. You can raise your hand. You can also just put come on mute, as well as put any questions into the chat, and Kurt and Bailey help facilitate that chat for us. As we're talking about anything, we always talk about some sensitive information, so please remember to protect individual privacy. Don't share first, last, any initials, conversations, or ways that we can identify who it is. Again, if you have any questions, reach out to a hub member on that one. If you've never joined an ECHO session, there's a few components of that. The first one is that we are trying to build that community of practice. So if you feel comfortable enough to turn on your camera so that we can see all your guys' smiling faces, it always is helpful to see that as you're a presenter, as well as just knowing who's on the call with you. We will have a didactic speaker, and then we do a case presentation with some amazing recommendations and feedback from all of you guys. We do encourage community interactions, and so please put your questions in the chat. Provide feedback for the case. If you also have a case or a family, a client that you're working with and you want some valuable information, please consider sending in a case presentation. We get great responses and some really useful tips to help with future cases. So if you have or are interested, please just reach out to projectscope@usu.edu. We do a survey. That is how we do credit for attendance. So we'll send you out a survey link after this session. We'll also be dropping that into chat several times. So please fill those out. Those are how we take that information and share it with our funders, and how we keep these sessions free of charge for everybody. Canvas is where we store all of our recordings, PowerPoints, any information is where we store that. If you need access to the Canvas page, just reach out to us and we'll get you access to that. We do have social media, and we share not only information about our sessions, but information and resources that other providers and groups share with us. So it's a great way to learn more about the ECHO, as well as different topics on there. We are thrilled today to have Eric Christensen talking to us about care coordination, and a reminder that our next session is August 9th. And so hopefully we will see you there. I'm going to go ahead and stop sharing and turn the time over to Eric.
Well, good afternoon. I'm really pleased to have been asked to speak today, and really dismayed to see my face so large on the screen. So I'm going to probably turn my presentation on here in just a minute. Before I do, let me just introduce myself. I'm Eric Christensen. I'm a program manager with the Department of Health and Human Services. I've been here for almost 24 years. I don't know where the time has gone, but somewhere in those 24 years, my ex-wife and I have raised a family. I have 3 kids ranging in age from 31 years to 25. My oldest son flies F-18s for the Navy and is at Top Gun right now, being tortured in more ways than you can imagine, so he can be a Top Gun graduate. And it's not all beach volleyball in San Diego. It's actually in Fallon, Nevada. So not as glamorous as what you see on the movie. My middle son does investment banking in Anchorage, Alaska. We went up at Christmas time and had lovely 4 hours of daylight, and that's not a place for me to live. And then my daughter, who's 25, is working on a degree in special education and works during the year as a special education classroom aide. My ex-wife is an elementary school principal in Jordan School District, and I've had the privilege of working with children with special health care needs for the last 24 years. So I'm really pleased to be asked to speak about this today and talk about care coordination. Before I do that, let me just tell you a little bit about the Office of Children with Special Health Care Needs at the Utah Department of Health and Human Services. We merged as two departments, Health and Human Services, last July. So we hit our anniversary just recently. And during those years prior to that, we had a pretty robust clinical presence in a lot of the state. So rural areas specifically, we used to take a plane full of specialists to Moab, Blanding, Price, Richfield, St. George, sometimes up to Logan, with occupational, physical, speech therapy, developmental pediatrics, psychology. We brought in neurology and genetics, and we would go for 2-day stints and evaluate kids around the state. In 2015, those clinics were shut down by Department of Health. And at that time, we started our Integrated Services Program, which has a focus on providing care coordination to children and youth with special health care needs. So with that preface, I'll go ahead and start my presentation. I just want you to know this is really friendly. So please, at any point, feel like you can raise your hand, interject, throw elbows, whatever works for you to get to feel like you can ask a question at any point, and I'm happy to stop and answer your question. And then I will include contact information, and there will be time at the end to answer any questions that you may have. So I'll go ahead and share my screen and hope that I actually bring up the correct one like I practiced earlier. So you should see something that looks like a slide presentation, and I will share that with you now. And I will ask you to do something for me here in just a minute. So can everyone see? Natalie Allen, does that look like what I showed you previously?
Looks great.
Okay, thank you. I'm going to ask you to do something for me here. We're going to do the first few minutes here. I want to get just some poll everywhere type questions asked or answered. So if you will, either on your phone or on your web browser, go to the poll everywhere. So pollev.com/EricChristen389, or you can go to text the Eric Christen 389 to 22333 wants to join. And then if everyone will just kind of nod, give me a thumbs up. If someone will kind of keep an eye on that, we'll do that. Hold on for just a minute or two. And I'm going to ask you a series of questions because I just kind of want to get a pulse on the room to see what perceptions are, feelings, thoughts, ideas on where we're going to go with this today. We'll give it just another minute or so. Okay, are we ready to go? All right, I'll go ahead and we'll go.
Nope, there was
Quite yet.
someone that I saw some heads shaking. Nope, not ready.
Natalie, you're going to be my my eyes there for a minute because I can't see all the way down the list. I do have probably 5 or 6 folks up here, but when it looks like we're good to go, if you will let me know. Hopefully that brought you up to something that looks like you could take a survey. All right. So one more time, are we good to go? Okay. So if everyone would kind of let me know kind of what you do, and I tried to kind of figure out what I thought ahead of time, what folks might be, what kind of folks might be in this meeting today. I was hoping not a lot of folks would fall into the other category, and it looks like I kind of bombed that one. So I might ask folks to kind of pop in and let me know what you do. Last time I did a poll, we had a lot of folks who were actually care coordinators, so it was much easier to do this. So, okay, so we have a lot of EI folks here. We have smattering of some medical providers, and then other, about a third. So I'm curious what the others are, but we'll ask about that in a minute. Okay. Let's ask this next question here. What percent of the families with which you work have a child with special healthcare needs? Okay, we'll give that just another minute or two. They're still trickling in. You're seeing those results up there. So roughly 2/3 of folks, somewhere to 75%, have kids with special health needs they're working with, and then about a third with 100% of the kids are special healthcare needs. Okay, interesting. I'm going to just give you the definition of a child with special healthcare needs that we use through the Federal Maternal Child Health Bureau. Children with special healthcare needs are children who have or are at increased risk, operative phrase there, or at increased risk for chronic physical, developmental, behavioral, or emotional conditions. They also require health and related services of a type or amount beyond that required by children generally. So this is our population that is frequently at a specialist, receiving supportive services, receiving all sorts of supports to stay alive, to develop and grow, to basically continue along a desired trajectory. So given that definition, I'm going to ask the question again, and it might sound patronizing. I just want to see if anyone has changed their answer. So given that definition, does that change your answer at all if we look at what that federal definition is? I thought I was being really crafty when I asked this question a second time, but I may not be as crafty as I think. So. All right, just a little bit of a shift there. Okay. All right, so let me ask you this one. Every year now, there is a survey that goes out. It's a national survey of children's health, and they survey across the country to look at certain child health parameters. There is a screening questionnaire that goes out at the very front of that. And in Utah, they survey approximately 750 families. So it's not a huge number, but there's a screening survey that they ask to determine if a family has a child with special healthcare needs. So they look at things like, do you have chronic conditions? Does your child take medication on an ongoing basis? Does your child receive psychological support? A whole bunch of questions like that to screen. according to the 2021 combined data set from the National Survey of Children's Health, what percentage of Utah children are reported as having special health care needs? Based off that screening there, what do you think it is? And it's a combined data set because if you consider 750 families are surveyed, of those families, what percent in Utah are classified as meeting children with special health care needs definition? So requiring services and supports greater than general pediatric population. All right, put the kibosh on that one. It is, for all y'all who answered C, it is 16.9%. And that is a combined data set because the numbers are so small when you look at that. So when you consider 750 people surveyed per year, the average for those 2 years was 16.9%. And that's what we have reported on for our maternal child health block grant that we're just submitting for reporting on 2022 that will be actually submitted to the feds actually on the 15th of this month. All right, so anybody who cheated after I gave the answer, you're disqualified. Just joking. Anyway, that's what we're looking at there on that number. And I want to show this to you because it's some very interesting data that you can actually look up yourself. This just shows what I looked up, and I actually pulled this up early this morning, that 16.9%, and gives that information off of their database. And this is the site. So it's childhealthdata.org/browse/survey. And if you're interested, you can go to this site and you can look at a whole bunch of different types of child data as reported on the National Survey of Children's Health. It allows you to look at combined data set years going from 2016 to present. And prior to 2016, this survey was only done sporadically, once every 4, 5, 6 years. They started in 2016 doing this survey each year so that you can see the type of data that is presented, but it helps you look at things like household income, education in the household, how many families report that their child has excellent or great health, how many parents report that they feel that their child is receiving care in a well-structured, easy-to-access system. So there are all sorts of interesting little tidbits that may inform the work that you do, just looking at some of these survey answers. All right, this next question, I'm really curious, because I'm sure we have some seasoned folks on here who have probably been around longer than I have working with some of these families. How much experience do you have working with children with special health care needs? Okay, we'll give just another minute here. Okay, interesting distribution there. Lots of folks been doing it for a while. We have some, it looks like we have some newer folks in there, which I love the mix. It's really great to have people a combination of folks who've been doing it for a long time and newer folks who bring newer education and different thought processes there. I jokingly say that I'm that old man who doesn't get technology anymore, so I appreciate young folks on my staff who kind of help me, get things and understand things. So I always think it's terrific to have, a mix of newer and experienced people, because I think we all benefit and learn from each other. Okay, and then with this distribution of experience, here's one more question for you. How often during the normal week do you encounter a family that has extensive needs that may exceed your agency's capacity to provide support? So how often are you working with these families and you're like, wow, the rug just got pulled out from under me. I got 25 years of experience and I just flat out do not really know how to help them. I can't help them. I don't know that our agency can help them. How often does that kind of hit you as you're working with your families? Has everybody had a chance to answer? So just a couple times a week? Okay. Good to know. All right. No one was our agency can do it all. So that's good. No one's that arrogant. And it looks like no one works for an agency that's basically a train wreck where they don't feel like they can handle a lot of that stuff. So that's some good news. Okay, this next one is kind of a general question, and you are able to populate this one on your own. So you can just put in as many words here as you like, but what are your community or other partners, community agencies or other partner agencies that you go to regularly or send your families to regularly for support? Kind of who are your big players or your ones that are just, okay, got a medical doctor. Okay, so Utah Parent Center. I love how it splits that all up. Utah Parents, there we go. Now it's all put together. Utah Parent Center. Okay, Early Head Start. Okay, their primary care doctor, their medical doctor. WIC. I'm going to have to rethink this one. It's splitting everything up. I thought if you put it all in as one phrase, so I'm seeing help me grow, split up all over the screen there. So not exactly a fan of this word scatter thing here. UCAP, okay. Therapies. So SLP, PT, those sorts of things, other therapies. UDAC, okay. So as in the Utah Developmental Assessment Clinics. A feeding support, so OT or SLP, those types of things. Psychology. Okay. So we have just kind of a broad group of those types of supports and specialists. So looking at all of these sorts of things, so our families, a lot of these children with special healthcare needs, as you know, from the definition, we know that our families and these kids with special healthcare needs just have a need for support services specialists at an amount greater than the general pediatric population. So given that we know a lot of our families have a lot of these needs, and several of you indicated that several times a week you have families that have needs that go beyond the capacity of your agency, possibly to serve them, let me ask you this one. What are your pain points when it comes to providing additional or support outside of your organization for the families you serve? And I have no idea why there were words up there already, but let's see if this is going to work for you. Will this allow you guys to populate anything in there? Is that putting anything in? Natalie, will that work for you? Okay, there we go. Wait list, okay. So rural. So folks being rural, wait lists. Lack of resources, okay. Putting the words all together in one thing, that's working well. Okay, limited resources, I like that. Okay, insurance, help getting resources, okay. Family unwilling, something I hadn't thought about, okay. All right. Doctor says to wait, okay. Overwhelmed families, okay. Lots of really tricky stuff though, that even though there's good intention, good, big desire on your part, wanting to help, a lot of times we hit that brick wall. There's just not either, there are not resources, you don't know whom to call, families are unwilling, primary care provider might not be willing. We jokingly in the past said sometimes coordinating the care coordinators is like herding cats. You know, it's like you have one office wants to do one thing, another office wants to do something else. You have a lot of willing partners wanting to help these families, but there sometimes it's like dueling banjos going on, trying to get help for the families. So this would be the question I have. Who are you going to call? What do you do? Who can help you do that type of a thing? Well, while we don't have a super cool car like that with a logo on there, you know, we just have state car with a, you know, state logo on there. I want to talk a little bit about our program and some other programs in the community that can help and partner with you when you're hitting that brick wall, because I know so often this stuff gets internalized. You feel like I want to help this family so desperately and I don't know what to do, or I can't because I have a huge caseload, or it's not in my purview, or we're not allowed to do that, or whatever. So let me talk to you about the Integrated Services Program. I've had the privilege of working with an absolutely amazing, capable team of professionals since 2015 when Integrated Services came about. And our Integrated Services team assists families of children and youth who have special healthcare needs by facilitating direct clinical services, care coordination, transition to adult healthcare, and advocating for primary care and comprehensive healthcare. So we do all of that stuff with the families we work with, but we're very different because we are not a specialty care office necessarily. We're not a primary care office. We used to be a specialty care office, and you'll see in a couple of slides that we provide some specialty care in a roundabout way. I'm sure Natalie can elaborate on that just a little bit, Natalie Allen, just a little bit for us. But our bread and butter here is to provide that additional support to our community partners who need help with the patients that they're serving. So let me just show you really quickly our partners within Integrated Services and the staff that we have. So I am our program manager and I am Spanish speaking. Natalie Allen, who is our advanced practice registered nurse and has worked with children with special healthcare needs for a really long time. We have a very part-time speech language pathologist, Lindsay Duke, who is really terrific working with our families on that part-time basis. Joel Manuel, an amazing occupational therapist. We have two care coordinators in our Salt Lake office, Walt Torres, who is Spanish speaking, and Julie Southwick, who is our transition to adult healthcare specialist. Our additional in-house care coordination staff in Ogden and all things up north, Tony Estrada, who is Spanish speaking, and Heather Carlson, who is an absolutely amazing RN and worked with families of children and youth with special healthcare needs almost as long as I have. In San Juan County, Lourdes Long, Central Utah Health District, Natalie Carter, Southeast Health District, Gwen Anderson, and in Tri-County, Erica Wall. We contract through Department of Health and Human Services with those 4 local health departments to pay for almost a full-time children's special health care needs care coordinator in those areas. And we love that because those 4 care coordinators are boots on the ground in those local communities. They know the community, they know the people, they know the resources in the community, they understand the school system, how things interrelate, and the dynamics, just all of that stuff on a local level. And so we really, really love working with our amazing care coordinators in those 4 areas. So if you live in one of those health districts, just know there is help there locally for you. Now, if you do not live in one of those 4 health districts, our staff here in Salt Lake or Ogden will help take care of any families that you need some help with. Our program basically has 4 main areas. So number 1 is that care coordination piece that we're going to talk about. The second is supporting the medical home. So ensuring that children have that usual and customary place where they can receive care, referrals, hopefully care coordination and support. That third is our promoting that transition to adult medicine or healthcare for children who or youth who are of transition age, anywhere from about 12 to 17, and we go all the way up to about 22-ish. And then that fourth one that I mentioned briefly is that providing limited direct clinical care services, and that mostly takes place in rural Utah, not necessarily along the Wasatch Front. So I messed these slides up this morning. I need to go back. I need to do this slide first and then go back to that next one. So this is what happens for going through these slides at 5 o'clock this morning, folks. Let's go over this first one. This talks about care coordination. We are funded through our maternal child health block grant in Utah. That's approximately just under $6.2 million that comes into the state to fund maternal and child health activities. That money has been flat funded for as long as I can remember. But one thing that hasn't changed is that 30% of that money must be used for children with special health care needs. So that is law. And in the state of Utah, we utilize the lion's share of that money to support the services that we offer through Integrative Services Program. And a big piece of that is that care coordination. We get referrals from primary care providers' offices, from specialty organizations, social services groups, all sorts of self-referrals. Folks who have received services from us in the past have talked to family and friends, and they have self-referred in. But we always do an intake and assessment. Quite often we get a referral from a provider who will say, we'd really like the Jones family, we'd like little Bobby to receive occupational therapy and they're having trouble getting in. But when we do that intake and assessment, we find out that dad lost his job, family's facing eviction, they have food scarcity in the household, and we realize several other factors. And so we try to work on some of those needs first before we hop in and take care of that occupational therapy concern or what have you. So it's really important that we do that assessment, really look for some of those needs and work on those first, and then we can kind of dive into what the original referral may have been. We create a care plan with the family, and we try to help families understand that these things can be done in bite-sized chunks. They don't have to do it all at once, and help families navigate the easiest and best way to make some of those things happen. We will connect families with CHIP, Medicaid, insurance, the insurance, oh gosh, I'm grasping for words, but the insurance pool that families can qualify, Obamacare type stuff. SSI, DSPD, some of the programs that exist out there for public entitlements, help them organize their records, create care notebooks that they can share with all of their information so that they don't have to regurgitate information all of the time when they go from specialist to specialist or support service to support service. We can explore housing and financial issues, look at programs through Department of Workforce Services, such as TANF and SNAP and some of those. So food assistance, temporary aid for needy families, things like that. We also partner with a primary care provider, and we'll make referrals to those organizations and do some, hand holding and provide consistent and regular follow-up with those families. Our care coordination team will sit down with families either directly or over the phone or online and help families fill out the applications that need to take place to get some of these services, and then follow up to make sure that families really did get in to the service to which they were referred, find out what any barriers were, and try to help eliminate those barriers. So our care coordination team can really be big advocates in breaking down those barriers that may exist for families who might be timid, have low education, or are overwhelmed, possible intellectual disability as parents themselves, and don't really know how to maneuver the system to try to get their child into those supportive services. I'm going to go back the one slide that I skipped. The next one is supporting the medical home. And we really, during that intake, try to verify that families do have a primary care provider. It's really important that they have that usual and customary place that they're receiving care. We aren't excited when we find out that a family, is going to WIC and getting their immunizations at local health department, which is great. Both of those are terrific. But when the child is sick or has a fever or a cough, they're showing up at the emergency room rather than getting all of those things taken care of at a primary care provider's office. So we really try to get those families connected with the primary care provider, and we can support that primary care provider's office if they don't have care coordination there or staff that can help really support those families with challenging needs. We can partner with that primary care provider to be that care coordination support in that office. We provide feedback to the family and primary care provider through the care plans that we put together. We will help make those warm handoffs to those service providers and run interference. And we can facilitate specialty care and connecting with any of those community services, through that warm handoff for services that families may need, or that the referent feels that family may need.
Hey, Eric.
Yes, please.
We did have a question. Someone asked if this program is no cost to families.
Excellent question. And I don't think I addressed that anywhere. So no cost to families whatsoever. This is all handled through our maternal child health block grant. And if families participate with us, there's no fee assessed, nothing. We don't care about families' inability to pay or having a third-party payer or anything like that at all. But if they don't have insurance, we're certainly, or Medicaid or CHIP or anything like that, we're certainly going to explore those avenues with them. So we will ask about it. And if they don't, we're going to explore some of those options with the family to see if we can't get them connected. Did that answer the question?
I think so. Tammy, did that answer your question?
Yes, thank you. Appreciate it.
You're very welcome. Okay, this next one, we have a transition specialist on board. We work on several committees to try to get a no wrong door approach established across the state to ensure that our youth are getting those supports and services necessary to move into adult healthcare and adult behavioral health. And there are a lot of considerations, and we like families to start considering that from the time youth are 12 or 13 years old. So this isn't a deer in the headlights moment 5 minutes before that child becomes an adult at 18. And, we try to prepare them early on by discussing those types of services. And then we find that when we're working with youth in transition, those families bring all of those care coordination concerns that our families of any age bring. And so our care coordinators work in tandem with our transition specialists to ensure that the families have what they need, in addition to those considerations they should be thinking about as their child becomes older and eventually becomes an adult. This last one, this number 4, is our limited, operative word again, direct clinical evaluation and diagnosis via telehealth. And this was put together during our COVID period when everything was telehealth, but our very plucky Natalie Allen hits the road on a regular basis and sees patients quite frequently in Price and Blanding and Vernal, other areas as needed. But we have our speech pathologist, occupational therapist, and pediatric APRN. And this is quite different from the days when we used to have, 10 or 11 specialists going to rural Utah to support our children with special healthcare needs. In that right now, much of the work that we can provide or support families is really through pre-diagnosis and post-diagnosis. Quite often we get referrals that families suspect their child may have an autism spectrum disorder. And when that happens, quite often we're doing what we can to support the family while they wait to go in for a diagnosis from a provider who can do that. Up until January of 2022, we had an in-house pediatric psychologist. After 3 months and 4 unsuccessful attempts at trying to hire, we had, get this folks, 0 applicants. After putting that out several times, we decided we probably had to change our game here at Integrated Services. And so the team was flexible, and we kind of worked with how can we support these families pre and post diagnosis. And amazingly, with excellent APRN skills and a terrific speech and occupational therapist, we're really able to give families some strategies to help them manage life at home while they wait to get a diagnosis, and not just ASD, but other developmental delays that we try to get diagnosed. So those are the types of services that we can provide. We also partner with the Early Hearing Detection and Intervention. That's what the EDI acronym on the bottom there stands for. And our care coordinators are also trained to help provide remote diagnostic audiological evaluations in partnership with the audiologists here at Department of Health and Human Services. It's remotely done. They get the kid the baby kind of wired for sound in the remote site, and then the staff here at DHHS is able to hop on and take the controls and run those tests for the kids. So we appreciate that partnership that we have with them. And then just one piece we want to make known, we advertise this where we can. I'm sorry, my cursor is not where it needs to be. We got a grant a couple of years ago to purchase hotspots and Chromebooks, and we have those at all 4 of those local health departments with which we partner, at the Utah Parent Center here in Salt Lake and at our Ogden office. And we loan those out to families who may want to do telehealth or need some sort of remote access to a consultation. And we will loan those out to families for one visit or an extended period of time so that those visits can take place. Some of our families don't have the best technology, and this can really help. The only drawback is, though, if you live in an area that does not have terrific cell phone coverage, a hotspot is probably not going to help you. So if you're miles away from cell phone tower, the hotspot's probably not a great way to go. But if all you're lacking is the technology and you do have cell phone or cell towers close by, this is a great option, and we're always happy to loan those out to families who could benefit. Let me just give you some really quick stats here. In calendar year 2022, our team provided approximately 6,000 patient encounters to over 800 unique patients across the state. And these were typically our top referral issues: suspected autism spectrum disorders, folks looking for support pre-diagnosis and post-diagnosis, sometimes not knowing exactly what's going on with the kiddos, just help finding resources. We get families who just don't know where to go. And then quite often just that connection with entitlements, Medicaid, DSPD, SSI, so supplemental security income, social security type services. But those are the types of referrals that we are getting. Just a little bit of a derivative of our children with special healthcare needs care coordination. We got a newly funded grant December of 2022 through the Office of Early Childhood that was newly formed here at Department of Health and Human Services to provide care coordination for the general birth through 8 pediatric population. The grant required that any participant provide a 30% match, which was a little bit limiting for some of the entities that may have wanted to participate. But 7 local health departments are participating. They're listed here. And they will be providing some care coordination and expanded services to that birth rate population. So this includes, for example, children who might be receiving targeted case management. That's a Medicaid service that typically goes to kids under the age of 3 or 4, depending on what the local health department can provide, for families are concerned about when they're discharged from the for babies that are discharged from the hospital. This grant would allow that local health department to say, we're worried about this family, the kid isn't on Medicaid, but we'd still like to follow them. Or say, we only follow the kid through age 2, normally through Medicaid, but we'd like to follow this kid for another year or 2. So the grant gives some capacity to anyone who's participating to offer an expanded range of early childhood services to those children. Now, the point I want to show here is that for anyone who has kids not in one of these 7 health departments or districts, Department of Health and Human Services, our ISP team, will cover the remainder of the state. We have a health program coordinator who's running this up. And hopefully within the next couple of weeks, we'll have 2 new care coordinators who can work with this population. So we're really excited to be able to offer that service as well. And basically, because these aren't children with special healthcare needs in particular, we may discover later that they are, but initially they're not. We're going to be connecting them with just standard services we would be looking at for those younger kids. WIC, high quality childcare, early intervention, Head Start. We may have expectant moms that call in, so we'll be looking for, prenatal care, getting kids connected with pediatrics, developmental enrichment activities. We will, as part of that screening, be administering the Ages and Stages questionnaire and the Ages and Stages questionnaire, social and emotional, as a screener. For any of new postpartum moms, we'll be doing an Enberg emotional scale to look at how new moms are doing. We'll provide tracking and follow-up, and we'll also try to run interference to eliminate barriers to see why parents are not able to schedule or get into visits with any of the providers or service organizations to which we've referred. I'm going to give you a few more resources that I'm sure you already know about. Someone put in their slide, the Utah Parent Center and Utah Family Voices. Excellent organization for parent support and training, help with individualized education plans, 504 health plans for any of the kids that you might be working with that might need those for school. Talking about guardianship, supported decision-making for some of our older youth and kids, but families to talk about financial planning for ensuring that their kids with special healthcare needs have the money available to pay for their healthcare. Social Security and SSI, Transition University for all things transition for kids or youth and young adults, and that peer and parent consultation. everyone who works at Utah Parent Center, Utah Family Voices has to have a child with special health care needs. So they've run that race. They know the ins and outs, and they have practical experience that they can share. And then they produce some of the best, well thought out online and live workshops. So absolutely amazing stuff. So if you haven't tapped into Utah Parent Center or used them, they're an excellent resource. And I highly suggest looking at their website to see everything that they offer. Another one that everyone should be familiar with, but we want to put up there as well, is Help Me Grow. They provide personalized parent support on parenting, pregnancy, and child development. They also do those ages and stages social and emotional questionnaires. They can provide activities to normally developing children, some enrichment activities, parent-child bonding, and they also connect to outside organizations for parenting classes, therapy, community resources, and they refer to us and we refer back to them. So we have a reciprocal relationship with them. And then this one is a no-brainer, and I hope I'm not patronizing by saying this, but always reach out to your primary care provider's office for some of that support. While not always well-staffed, often your patient's client's PCP's office is an excellent resource for coordinating some of the concerns that you may have. Many of the pediatric offices across the state do have care coordination, not all of them. And if they do not, you're always welcome to reach out to Integrated Services for some of that support. And I'll just open it up for general questions for a minute.
Well, Eric, while people are thinking about questions, and please feel free to either put those in chat or just come off mute. I thank you so much for your time. That was great information with it. I know that I've used you guys for families that I serve in our early intervention Part C program. So useful.
Well, and we appreciate referrals from anywhere. Again, we have an amazingly compassionate, kind team. Again, several bilingual Spanish, English speaking staff, and we also use a terrific language line. They've been very responsive for any of your families who speak a language other than English or Spanish. And we can almost always get an interpreter on the phone within probably half a minute for some of our more, we've had some pretty exotic languages and they've almost always come through for us. So we're happy to help out with some of those things as well.
That's awesome. And then there is a question in chat that says, do you have access to medical records from IHC or other systems?
We sure do. If we get a release of information signed by the parent, and then we will request those records like we just would any place else. So we do have access, but we get that release signed by the parent, guardian, whomever, and then we submit that and request those records. Or we do have access to both iCentra and Epic Link. And once we have that release, we can pull records up. But quite often, the people who refer children to us will send, quite a bit of information ahead of time. So, we do get that. One rule though for us is we are never allowed to pull reshare records that we get. Those are, if a parent signs for us to get records, we can use them for our internal use, but we're not able to get those and then reshare them. So that just follows standard HIPAA protocol.
Okay, so I have a question. It's Pat. I was the one that asked that question. So once you get a release, you can literally get into iCentra and Epic and see records?
We can.
That's fabulous. Okay.
And then the other question is, can families contact your company directly to start receiving services from you?
Absolutely. We will take a referral from however it comes in. If we telegraph, whatever, if families want to contact us directly, they're absolutely able to. We get a lot of word of mouth. We always smile. My absolutely amazing Tony Estrada in Ogden is a cottage industry up there. She works so much with the Hispanic community, and that just word of mouth spreads up there. So you'll find that a neighbor got great services and told somebody else, and then that person calls Tony and they get in, and we'll take a referral however they like. So it can come in by calling us, that 801-273-2988. Families can self-refer or sending to integrated.services@utah.gov is a generic email for us, and that hits 3 or 4 of us and it bumps over to our mailbox, so we make sure we get those. And our team's really great at trying to reach out to those families extremely quickly. We always ask that the team closes that referral loop, though, reaches back out to you to let you know, if you make that referral, to let you know that we have contacted the family, so that you didn't, if you made the referral, that it didn't just get, lost in the pneumatic tube somewhere. So we'll try to let you know that we did get that.
And I just wanted to add that sometimes in the rural areas, the primary care providers might be hesitant to, I don't know, let's just say diagnose ADHD because they're not familiar with meds, they haven't done it. So even though I'm not the primary care provider, I'm really happy and having some success in just supporting primary care providers with initial diagnosis, starting kids on some meds, stabilizing them, and then I just send them back to the primary care doctor. And then when things kind of get messed up again, they send them back to me. And I think that can be a way that we can decrease barriers for some of the rural families, because it's just so hard to find, they don't want to travel to Salt Lake or any of those. They can't. Some of them just don't have the ability to travel that far. So I can support primary care doctors in some of those rural areas.
Thanks, Natalie.
Fantastic. Any other questions? Well, Eric, again, thank you for your time. So we're going to move right into our case presentation. And our case presentation today is a little bit of a unique one. This was some ideas that our hub team pulled together on cases that we know tend to happen frequently. And so it's kind of a combination of a lot of things. So in our case, we have just a little background on the case. It is we're working on trying to figure out ways to support the mom. So she is a 30-year-old female who is pregnant. She is currently in a Pathways Care for obstetric OB, substance abuse treatment, and medically assisted treatment for opioid use disorder. She does attend weekly sessions, but she's tested positive for illicit stimulants and denies intentional use of drugs, but she's around others who do. She already has 2 children, a 4-year-old and a 1-year-old. The 4-year-old is in kinship care due to mom's return of using 6 months after the 1-year-old was born. The 4-year-old has hyperactivity, aggression, is not easily redirected, and they are considering Head Start enrollment for him. The primary concerns for mom is that she needs to make that stable recovery. There are some partner concerns, supervision of her children in kinship care. She did not complete high school, and others in the home use drugs with the father's permission, and leaving the father could jeopardize contact with the children. Concerns for the children are that mom's pregnant, she has 2 sons in kinship care, and hyperactivity of the preschooler. These are some of the goals that she has, as well as some of those barriers. She has some really good goals of getting custody of the children, creating a nurturing and well-supervised environment, and then helping with the preschool's hyperactivity and aggression. Some of the barriers are that mom's continued drug use during the pregnancy, relationship with the kid's father who has been abusive, and his relatives are who the kids are in with for kinship care. So she feels like if she can't leave the father without limiting her chance of contact with her other children. And then she also says that the children are not being well supervised. So the strength is that mom is engaged in treatment. She shares her treatment information with the Division of Child and Family Services. She has a steady income from disability checks. She wants custody of her other children, and the maternal grandmother is active in her life and provides that stable environment for the children. Her sons are healthy and energetic, and they do have a strong bond with the mom and maternal grandmother. So we're going to break into 2 breakout groups, and really the things that we would love to be able to discuss in these breakout groups are what resources, supports, or tools could we give a mom who we are serving that is similar to this situation to help her create a nurturing environment so she can get custody of her kids? How can we help create a nurturing and well-supervised environment in the present placement with the kids in custody? And how can we get the preschool's hyperactivity and aggression under control? And like I said, it's a case that many of us have probably experienced in different realms. And so I think that all of us will have some really great, useful information. As we do breakout groups, remember to just introduce yourselves, tell us where you're from, and then designate a person to take notes. So Bailey, if you want to go ahead and put us into breakout groups.
Okay, those groups are open. I hope. If you don't see that, an invitation, let me know.
I'm going to read something to you. Chapter 3 is primarily providing services in the combination of virtual and home-based visits. Your individual pattern of call and virtual home visits will be discussed at the eligibility IDRPP based on your child's goal and service plan.
Wow, everybody went to a breakout group. Here they are. Okay, so again, we're just going to share. So Natalie, if you'll share from your group.
So our main, we started out with just, if mom wants her kids back, we've got to keep her in recovery and find enough support for her. And we talked about USARA, the group that came and spoke to us, that they would be a great place to hook her up with religious organizations that may have 12-step programs. And that might open up maybe some opportunities for additional social support. And then is it SAMHSA, SAMHSA? We talked about getting there. So if you can see the theme there, we're figuring out how do we best support this mama to stay on track. Then we briefly talked about education on what are reasonable expectations of the children and their hyperactivity, and is there some confusion between environments because they stay with different people. If everybody has different expectations of the children, that's going to make it even harder. So just maybe, is there the ability to meet with all the people who care for the child, to all the children, so that we can have some consistency in their life? Now we talked about wondering if mom's getting any kind of medical support for her substance abuse, and maybe the Super Rad Pregnancy Clinic could be a place that she could go. And then also vocational training for mom. And right now it says she's got disability checks, but if she moves in with her mother, what happens to those checks? And do we need to look into that? But yeah, those were the main areas that we talked about. So
those are great examples and resources. Kurt, I don't know who on your group took notes, or
I took notes. Tiffany led the conversation. Tiffany, do you want to summarize? You want me to?
Go for it.
Okay, so we talked a lot about just the overall theme I got was making sure we're supporting mom. Mental health issues, if she needs some support there, places that she can go, that she can feel safe and kind of out of the chaos of that. And that may be a specific place in the house. It could be an activity they have in the community. It could be people coming in, Part C early intervention or Head Start or home visiting that could come in and help support. Also talked about the family support center that could maybe offer a couple hours of babysitting so the mom could have some time to herself, just to kind of make sure she's taking care of herself. The support to have her continue with recovery programs is going to be critical. That also ties in with the hyperactivity and aggression. Obviously, with the chaotic environment, it's going to lend towards the hyperactivity and perhaps some aggression. So we want to make sure there's a primary care provider with well child checks to make sure any kind of medication or anything that might be needed by that child to help decrease hyperactivity or aggression. Also looking at occupational therapy, perhaps through early intervention Part C or through a clinic somewhere that would help to identify if there's sensory issues with sensory processing or integration, and if there's any facilities or treatments out there that wherever this person is, could you be able to help her with those sensory issues. So that's kind of where we went.
Wow, great resources. So if your groups will send your notes to bailey.bb@usu.edu, she will compile all of those. All of our recommendations for all of our cases are always on our Canvas page. So if there was a case presentation that you really found useful and you want to go back and hear what everybody said, you can always go back and access those. And then just another plug to, if you have a case presentation that you want to have us all brainstorm and get information for you, I cannot tell you how helpful they are. I've submitted some of my own personal cases that I work with and am able to take it back to the families with some great information. Our next session is going to be August 9th. And we are having USU Extension coming and talking to about their opioid in rural access and rural areas program that they have going. So thank you so much for joining us today, and we will hopefully see you in August. Thank you again, Eric.
Thank you.